All right, so let's jump right in first and talk to Dr. Weil. And so now, when people think of liposuction, they think about, you know, the tummy, the legs, you know, the bottom area, but not usually the neck. And that's what you're going to talk about, is what you can do for a chubby neck.
That's correct. Well, suction is very good for all of those areas that you mentioned.
Yeah.
But for the neck in particular, it's somewhat special because that is an extremely, fairly straightforward, simple procedure that can be done in office.
Yeah.
And it's something what we call liposculpture as well.
Yeah, because it seems very slight compared to a big old leg you need to suck a lot out of.
That's correct. So it's sculpting, really. This is more of a sculpting procedure.
Okay. But wait, so you said you're going to suck a little fat out because, like, if I have the thing going down, let's say I'm exercising, I look great, but I got that thing. But then isn't there going to be hangy skin there you're going to have to do something with, or does it kind of...
You know, you just have to pick the right person. But the nice thing about this procedure is that men or women are good, anywhere from 20 to often in the 60s. As long as the skin is relatively good, then once the fat comes out, the skin responds and snaps back like a rubber band. Oh,
so it can't be that, I was telling you, I'm watching my mom to see how my neck's going to be, right? She's 76, and it's starting to, like, hang a little. That's not for this, that's not for liposuction. That's what you're...
Probably not. No. I would think people, maybe in their later 60s, early 70s, would probably need more of a skin tightening procedure, in which a lot of times we will add liposuction too. But this procedure is different in that it is only suction.
So is it more of a hereditary thing that you'd have this fat here? Or what if I'm fat all over and my neck just bugs me? Would you do that?
Yes, sometimes you can, because sometimes in some individuals, men or women, mostly women certainly, the neck is so important. And that once the fatty tissue comes out of the neck and they have a nice contour again, they're very happy. And it makes them look, frequently it'll make a lot of people look 10 or 15 pounds lighter, which you'll see in the photo.
I would say that's a good little tease, because after the commercial, we'll look at some of the photos. But what about after you suck it out and I'm all happy, is it going to come back if I gain some more weight or late?
No, it's a good question. No, it does not come back. So this is a permanent procedure. Now, that doesn't mean that over a period of time that the skin will become lax over the next 10 or 15 years, certainly, as you age. That fat will not return.
The fat, okay, so even if I gained a bunch of weight, I'd gain it somewhere else, not there.
Not in the neck.
I see. Okay. Is there a lot of downtime for this? Because I'm assuming you got to put the little holes in there and somehow...
Yes. No, the great thing about this one is that people come into the office. We usually will give them maybe a little Valium by mouth. A very small little incision is made right under the chin and near the ears. Little numbing like at the dentist's office. And then some salt water goes in, which is what's called, this is called tumescent suction, and that just means the area is tightened with salt water. And that just makes the fat soft. Then it takes about 20 minutes. And with a small little cannula, which these little tubes, very small, maybe 2-millimeter tubes, the fat is removed.
2 millimeters, is that
That's like the end of that pen.
Oh, it is? Okay, so a little hole right back here.
Yes, you do not see these holes.
You don't see it?
Nope, do not see them.
And then what about being sore afterwards, or having to wear a little, do you have to wear like a little something, a little neck
people
thing?
will wear a neck brace for about 24 hours, maybe 48. So a lot of people will do this on Thursdays and Fridays. By Monday, you're fine. You'll still be sore. You'll be sore. And you may have some bruising, certainly, and a little bit of swelling. But
turtlenecks, that's a good thing. It's not like getting a face job, right? You know, you just wear a turtleneck, you're all set.
No, it's perfect for that.
Wow, very good. Okay, more men or more women?
Certainly more women.
Really? I was going to guess men, because you're wearing a tie right now, and that's the thing where, you know, you really... if it's going to come over, it's going to come over that shirt, you know?
That's right, that's right. But most men, it really is probably more loose skin than in men. Women, it's certainly, I don't know why you have more fat, but you have more fat. And so the women, that's right, that's exactly right. But it's certainly women, probably 8 to 2.
Okay, all right. Well, listen, we're going to look at those photos in just a second. I'll give you time to think about if you have any questions, too. And for more information, you can contact Dr. Weil at 415-781-2081, and you see his email there too. And for the first 15 callers, by the way, that mention this show, Body Beautiful, you will be able to get a complimentary consultation plus $50 off an injectable treatment. So now we're going to take your calls, continue our talk about plastic surgery of the neck and these liposuction of your neck, and we come back and take a look at those before and after photos and see if you see the difference. We'll be right back. The proof is in the pudding. and hopefully the neck doesn't look like pudding. All right, we're fixing your neck with Dr. Raymond Randall. Sorry, Randall. All right, so we're going to show some before and after pictures, which I really am anxious to see. And we also have a phone number. If you have any questions, you can call us right now live on the air at 1-800-440-4884. I'm seeing a couple calls come in, and we'll see. And they're about multiple procedures. These guys are interested. Maybe they've had other stuff done. Okay, hold on, guys. We also have a few emails because I really want to see before and after, don't you? All right, so let's take a look at a couple.
Great.
All right, put it up, guys. Let's take a look. Now this is so. Okay, you're telling me this woman had nothing done but the neck lipo.
Frequently, that's how it looks. This is a woman who's in her probably late 30s.
Yeah.
And she looks a little heavy on the left-hand side.
Yes.
On the right-hand side, you see you get your jaw back, you get a nice contour of the neck.
So you didn't put the jawbone in, you didn't do anything to her eyes?
You will see no incisions on this woman, and it's probably, again, a 2-3 day type thing. It may take a month or two for everything to settle down, but within 2-3 days, you're really back and looking that good. I
gotta say, yeah, because I'm not a proponent of. I won't say like, "Whoa, that's awesome," unless it is. I'll just go, "I see a change," but I'm telling you, that's awesome.
You can get some amazing results on some people.
Okay, now we're taking a look as we look at this next one because now this is a little more subtle, the difference here. People are asking. A couple of people. Here's Michelle from Livermore saying, "What about multiple procedures at one time? Like, let's say this lady wanted to get the neck, which you did for her, and then maybe I don't know, an eye lift or something, because you save money too."
Frequently we'll do, someone will come in for suction not only of the neck, but maybe the arms and the abdomen and the thighs.
Oh, so, but you use a different thing for this, but you do it all at once.
Yes, it's not quite as much sculpturing there.
Right.
It's not called liposculpture, but it's liposuction.
And it's okay, it's safe.
Oh, sure. Oh,
right.
This particular procedure may only take 20 minutes.
Okay.
And so a lot of times these procedures will be 2-3 hours, and you can do a lot of procedures.
So number one, callers are asking me, you can do this if you've had a procedure before, and you can also do this if you want multiple procedures at the same time.
Oh,
wait, what if you already had a facelift or something? Can you go back and do that later?
Well, oftentimes if you've had a facelift, then they may have already worked on the neck. So at that point, you may not have extra fat in the neck.
Okay, all right. Let's show another picture. I know we have a couple of them, don't we? Do we have another one? No. Well, let's go back to that first lady. As I just asked you, one of our emailers wants to know, this is Megan from Livermore, why is revision cosmetic surgery more difficult than a first-time surgery? Like, so let's say you go back to do it.
Sure, it's more difficult in any surgery. It doesn't matter, but there's scar tissue which forms, and so that always makes it more difficult.
That's different. Okay. Hey, let's get Maria from Berkeley on. She's on hold right now. Maria, are you there? Hi, Maria. We just lost her. How about Michelle from Livermore? Are you there? Michelle? We got all these people on hold. Hi. Hey, you were asking about multiple procedures at one time. What do you want to get done? A couple things?
Yeah, a breast lift, a tummy tuck, and liposuction around the thighs and back area.
Okay, so
I'm just wondering how safe it is to do all three of those.
Okay, so do you mind answering that? It's not about the neck, but yeah.
Frequently, most commonly, we do multiple procedures, and a lot of it depends on time.
Yeah.
So we won't really go more than 5 or 6 hours.
Now, what she's talking, Michelle, I know what you're talking about. That's the mommy makeover. Did you just have a baby a while ago?
Yes.
Yeah, see what I'm saying? Right, and you look at yourself and you go, this isn't the way I remember myself.
Sure, we do
You know, I was bigger up here and smaller right here. Right, Michelle?
Pretty much.
So, right? Okay, so it's okay, but it's a time thing. So she might have to pick a couple things and maybe go back and do a different.
Yes, a lot of times we can do multiple procedures in 4 or 5 hours, and it's very safe, as long as people are very healthy, which most young folks are, so it's not an issue.
Okay, good luck, Michelle. Good luck to you. I know how hard it is, right? You know, to get your body. Hey, I did want to ask you, too, just myself about money. A lot of people are concerned.
Sure.
How much are we talking in a ballpark for a neck?
Usually it runs $3,000 to $3,500.
Okay. All right. Just so that we know. I want to say there was another, this is an interesting email we got. Tracy in Melno Park. Will neck liposuction help with my wrinkles?
Not so much.
No?
If you just have loose skin with not a lot of fat, it really is not the appropriate procedure. But if you have some looseness to the skin and some fat, yes, it will help. Because you need more skin, actually, to recontour the neck as it goes straight back and down versus just straight down. In other words, you need actually more skin. So it's good that you have a little extra skin because it'll be taken up with the suction.
I gotcha. All right, well, those were amazing pictures, and I mean, you did that work. It looks good to me. But again, you have to consult with your own physician. Unfortunately, we're out of time, so if you have any more questions, you can contact the doctor. There is his number for Dr. Randall Weil, 781-2081, 781-2081, and there's There's his website, randallweil.com.